When whooping cough takes hold, the complications can be serious. Some of the known complications include pneumonia, a lung infection common in infants, apnea, pauses in breathing, in newborns, seizures due to oxygen deprivation, weight loss and dehydration from persistent vomiting after coughing fits, encephalopathy, brain swelling or damage, though rare, rarely long-term hearing loss. For infants under 6 months, the risk of serious illness is especially high because their immune systems are immature and they cannot yet complete the vaccine schedule. Maternal vaccination helps, but not all expectant mothers are getting vaccinated.